In the present system, assuming that we are able to pay for this, how do you even know what you're supposed to pay?
Let's talk about some of the frustrations with the current medical model that we were trying to improve on with ZüpMed.
So I had an appointment the other day with a man parts doctor.
A urologist.
If one must say so.
Mm-hmm, mm-hmm.
But I had an appointment with a urologist, and I arrived 15 minutes early for my 2 o'clock appointment, and I filled out the gazillion forms that I had just filled out not that long before. And then I waited. I waited. And I waited. And really a little bit past 2 hours after waiting, I was ushered back. I spent 5 minutes with the provider who said, yeah, everything looks great. We'll see you later. I don't understand whether if I worked as a car mechanic or a nuclear physicist, my time is valuable.
Right.
And I don't understand why anybody's time is more valuable than mine.
Right.
And so to begin with, I had to wait for that appointment just to make it. I mean, I waited 6 weeks down the road before I could even get in. I waited 2 hours before I could see this provider. I got 5 minutes of time, which in reality, I probably could have answered a couple of questions and on the telephone and probably solved those problems.
So you're addressing time efficiency and you're addressing access to care.
Yeah.
Both in that one example. For those two reasons, we were creating a model that recognized that our time is important and our access to someone with medical knowledge and the relationship also with that person.
Sure. So let's talk about that access to medical knowledge, subspecialty knowledge. Our young son, the performing musician, had a motorcycle MVA not too long ago.
Don't remind me.
Right. So he complains of knee pain, and being the kid of a physician and a pharmacist, what did we do? We just said, suck it up, take some aspirin, let's move on. And a month later, we finally said, all right. And we pulled a favor because we know people. We pulled a favor and got him in to see an orthopedist. And the orthopedist said, yeah, your knee hurts. That's true. We should get an MRI. And we said, okay, we'll get an MRI. You're the orthopedist. So how long did it take before he got called?
2 months.
Yeah.
2 months later to tell him that
his knee was broken.
Mm-hmm.
Yeah. So now understanding that we're pretty well connected in the industry, right? And it took us. Now, granted, we were able to get him in immediately, but it was 2 months before somebody followed up and said, your knee is broken. Now, by that time, it's probably healed, although he's still...
Or in his case, not.
Not, right?
But you would like to intervene earlier rather than later.
Maybe, but the fact remains is that somebody should have followed that up.
Yeah.
So you've got efficiency, access, quality, right?
And value, we've already talked about.
Well, value is the one that you really need to hit because we are dealing with some medical expenses from 2023 right now. And we're getting bills every single day. And not only are we getting bills, but we're getting calls from collection agencies.
Well, and our insurance, we met our deductible. We also met our family maximum. So I'm still calling to have the insurance companies for it to be resubmitted because insurance should pick up this. We should not owe anymore. We have already paid our
maximum. We should not. We
Yes.
should not. So here's the key to all of this. We've both practiced in the medical field for 25, 30 years now. And we still struggle daily to try to understand what we are being billed. And we are writing large checks only to have somebody call us later and say, no, you didn't owe this. It's already been taken care of. Oh, you do owe this. Oh, we're a collection agency and we're going to report you. In the present system, assuming that we are able to pay for this, how do you even know what you're supposed to pay? And you're not. It's such a sleight of hand process. Oh, pay this, don't pay this. How long have you spent sitting on the telephone with insurance companies?
Well, every day we spend not only for our personal insurance claims, but for patients and just trying to have approvals for drugs or medications that require a prior authorization. It's so frustrating to spend your professional career working through insurance debacles when you could be utilizing the experience, training, and education that you went to school for and helping them therapeutically. It is an issue. What we were trying to do, access, efficiency, time, transparency with what we're charging for and what you will not receive as a subsequent bill. There are still issues and it's not perfect, but these are all things that we are intentionally trying to improve upon because it needs to be improved upon.
Yeah. I mean, we try to limit the amount of paperwork. We say, hey, you've signed this one time. Please let us know if anything changes. Otherwise, we're going to go ahead and hang on to this. I mean, there's no reason to duplicate your paperwork, right? In terms of access, we go ahead and say we have same or next day appointments for our members. That access is the true added value of a membership at Zup. And granted for concierge medicine and generally for direct primary care also.
People ask me, why do I need to be a member? And you don't need to be a member of ZüpMed. I think members from our survey, we learned they pay because they like that access. When you're someone who has a chronic illness like blood pressure and it needs to be monitored more frequently, as a member, you're given unlimited access to us as providers. And so you could come in once a week and keep track of, and as we make tweaks to your blood pressure medicine. Sure. And that is almost unattainable at other insurance-based practice models. You wouldn't have the time to go once a week to your doctor. It would require a day off from work almost every week. We, by very nature of the variety of services that we offer, cannot bill for insurance. Instead, we are very transparent with pricing. We give each person a super bill, and you are welcome to submit that super bill to your insurance plan to be counted towards your deductible or actually receive reimbursement for that, depending upon where you are in meeting your deductible. But we are out of network, and it is a choice to come to us as a guest or as a member.
It's not perfect.
It is not.
It's not perfect.
But we are improving upon, and our mission is to challenge the status quo and to bring hospitality to healthcare. And I think we're on our way. We're continuing to make tweaks such that it improves the overall patient experience. And really that's in itself what healthcare should be about.
Amen.